Hi, I'm Miss Rock, and I'm an instructor here at MTTI. I'd like to take a minute to talk about our program and to give you some information and a look at what we do. This program is medical coding, billing, and office administration. So it encompasses a lot of things that would happen in a medical facility. We teach anatomy, pathophysiology, your ICD-10 coding, which is coding all the diseases, CPT coding, which is coding the procedures. So what we do is take things that are complicated and put numbers on them so that the doctors can get paid. Also, you will learn Excel and all of the Office suite. You will learn insurance and medical billing. You're going to learn also electronic medical billing, and that will make you ready for any facility that you would go to. The other exciting thing that is different with MTTI is we do teach hospital coding, not hospital billing, hospital coding, so that if you decided you wanted to go into hospital, you could feel prepared to start your new career as a coder in a hospital. This is an opportunity for you to do anything in that field. You know, if you were an auto mechanic, you're an auto mechanic. But if you're taking this course, you have many paths to choose. You can be a biller, you can be a coder, you can be a surgical coder, you can do claim submission, you can also, with a little more schooling, become a cancer registrar and be a scribe, which is actually working with the doctors and helping them to code. So if you're looking for a career and you're not sure what path you want to take, this is the perfect opportunity. You don't like it in coding, you can go over to the billing. You don't like into billing, you can go to claim submission. There are so many different opportunities out there for someone that is undertaking this program.
I was worried about how things were going to go. I was worried I wasn't going to understand anything, and then what was going to come next, you know. But everybody did such a good job of getting us prepared, and Sean was great as a career specialist in helping me with my resume. I mean, especially because I had worked pretty much one job my whole life, and now I'm changing careers, and at 41, it was terrifying. But everybody just did a really good job of making me feel that I was making the right decision.
Now, what makes me qualified to teach you? That is a good question. One I probably would want answered also. I've been in the medical field for over 30 years. I've been teaching for 15, and I was the operations director for the largest freestanding health center in Rhode Island. We had over 10,000 patients, about 5 satellites. So I am familiar with all types of coding. We had surgery, we had mental health, we had dental. So we have a broad base of knowledge of all of these things. Okay, and so that is the experience I would bring to you. Now, the other things that I want to tell you about why you should look at MTTI, it's unique, okay? It is unique in the fact that the teachers are almost always available. And despite the fact that we say we are online, I do come into the office once a week. And that's in case a student needs some in-person tutoring, or if they just want to see me face-to-face. So once a week, I am here physically. So it's not like you're abandoned and you have no opportunity to come in. Having said all of this, of all my experience, I come online every day excited about what we're doing. I have never lost my passion for coding. I have never lost my passion for any of this stuff that we are doing in the medical field. Why? Because it's constantly changing. It's a challenge. I have to be on the learning side, the cutting edge of everything that's coming out. Now just look at what happened 2 years ago with the pandemic. The minute that happened, I was sending out texts, I was sending out emails to all the students telling them all the new codes that they would be using. So you never get rid of us. We are always there as a backup to you. And that is one of the things I think that makes MTTI unique. I hope to see you in one of my classes. Thanks.